Up in the next 90 minutes, civil society demands scrapping of a Japa royalties deal and prosecution of state officials who breached laws in the process. We hear from their leadership. Also, no processions, rallies or keep fit walks. Governing New Patriotic Party in the Greater Accra region suspends large gatherings to campaign as part of efforts to limit the spread of the coronavirus pandemic. And we take you to the towns, villages and homes across the country where politicians are blazing the campaign trail ahead of the December polls. My name is Daniel Dazi. Welcome to the Pulse. Now, to begin with, the coalition of civil society organizations working in the extractives, anti-corruption and good governance are calling for investigation and prosecution of officials who may have been found to have breached any laws in the Japa royalties deal. According to Dr. Steve Mantia, who spoke on behalf of the CSOs, the deal is completely defective and beyond repair. The coalition is also calling for the entire abrogation of the Japa royalties deal as against President Akufo-Addo's directive that the deal is sent back to Parliament for reconsideration. Here's Dr. Steve Mantiao. He spoke at a news conference on the deal this morning.
Subsequent to the report from the OSP, the President of the Republic, Nana Addo Dankwa Akufo-Addo, instructed that in the interest of transparency and accountability to the people of Ghana, the agreements supporting the transaction that were submitted to Parliament and approved by the House should be resubmitted to Parliament for the approval process to start all over again. He further urged the Ministry of Finance and the Minerals Income Investment Fund to take necessary steps to ensure that the feedback from their consultation with stakeholders are addressed to engender public confidence. While we commend the President for acting on the report, we hold the view that the specific course of action directed by the President is inadequate and not sustainable. A proper reading of the report of the OSP should lead to two conclusions. One, that the deal is defective beyond repair. Two, that there are potential breaches of various laws, Public Procurement Act and the Public Financial Management Act. Furthermore, the range of steps that the President has asked the Minister of Finance to take to repair the defects in the Japa transaction objectively amount to there being deep-seated fundamental flaws.
Now, the coalition is also saying they do not support current calls from some quarters for the dismissal of the Finance Minister and other officials in the transaction. The National Democratic Congress have, for instance, called for the sacking of Ken Oforiatta, but according to the civil society organizations, they will only endorse calls for the removal of the Finance Minister if a court of competence jurisdiction endorses their culpability in the deal.
To the specific question of whether we support the call for the dismissal of the Finance Minister, I would like to refer you to the statement that I've just read, which encourages a special prosecutor to go the next level of properly investigating the matter and indicting all those officials who may have been implicated in any wrongdoing and maybe taking them through the court processes. It is only when a court of competent jurisdiction has found them guilty that we can now, on the basis of that ruling, begin to call for certain actions, which may include in the event of the finance minister being found guilty of the charges against him, we can ask for his removal. At this stage, I would say we do not have enough grounds to call for his removal. He may, on moral grounds, however, if he feels indicted by the corruption risk assessment report, he may voluntarily recuse himself or step aside, as we normally say, in the processes leading to any attempt to even remedy the transaction. But of course, we made the point that we don't think that this transaction is redeemable.
And whilst the CSOs are full of praise for the special prosecutor on the corruption risk assessment undertaken, they, however, believe there are still some important issues around the deal that he should have uncovered.
We take this opportunity to applaud the good work of the Office of the Special Prosecutor, even as we note that, constrained by various factors, the report was unable to address other important matters, such as the valuation of the royalties in question. It also falls short in not recommending actions to cure the potential illegalities and the processes and the process breaches outlined in the report.
Now let's take you to the campaign trail today, and we touch base with all the candidates on the ground. We have Dr. Mahmoud Bawumia in the Upper East region, his wife Samira Bawumia in the Northern region, plus the special one, wives of the main candidates, each in their home regions, Lordina Mahama in the Bono East region, whilst Rebecca Ekufado continues her tour of the Greater Accra region. It's been fun so far, to say the least, except the concerns about the lack of adherence to the COVID-19 protocols by their supporters. Now, for the main candidate, President Ekufado has been busy in his office here in Accra. Elton Brobbey will join us with an update on what he's been up to. But in the Ashanti region, his opposite number, John Dramani Mahama, remains on the ground. In the past hour, he's been meeting with Asantehene Otumfuo Osei-Tutu II at the Mencia Palace.
He was our northern brother. Didn't he say that? That we should vote for him because he was our northern brother. And by and large, the North did vote for him. Isn't that the case? He went into office for 8 years. For 8 years, he was in office as vice president and president. Can the Upper East tell us what exactly did John Mahama do for the Upper East region in 8 years? 8 years. Where are the programs? What legacy? What legacy did John Mahama leave in the Upper East region after 8 years? The signature development project for the Northern region was SADA, right? Upper East region. When Nana Akufo-Addo said he wanted to do it, the NDC and John Mahama said it was not possible. They said we should wait for 20 years. They asked where we were going to get the money to do free senior high school education. In their own mind, it was not possible. After all, if you cannot find 70 million Ghana cedis to pay for teacher training allowance, where are you going to find 2.2 billion cedis to pay for free SHS?
Bibia atoni kwemu enti ebaya yebesom na ya chianana na yɛde yɛnkyea ama asanteman nyinaa na yɛakɔ aprɔbɔ ɛwɔ Ghana nyinaa ɛnyɛ nnɛ na ɛdi kan a maba ahemfie ha na mmerɛ bia ɔkasa otu yɛfo ɛfa yɛamanyɔsɛm ɛne saa nneɛma nyinaa mekae sɛ mmerɛ bia ɛnkyɛ bia yɛbaa ha dwabɔ se ya na ɔka kyerɛ me sɛ campaign no ɛnyɛ ntɔkwa ɛnyɛ atam didie ɛwɔ sɛ yɛn nyinaa sɛnea mabɛdi ɔmampanyin da mmerɛ bia mekɔ a ɛwɔ sɛ meka nneɔma a abra meyɛ mampanyin meyɛeɛ na mekyerɛ baabi ɛtɔɔ sin kakra na sɛnea yɛatene no afa ɛne nea yɛba a yɛbɛyɛ nti saa deɛ a wɔkae no atɔma som papa nti fi sɛ yɛkɔ aprɔbɔ no baabi a mekɔ biara nneɔma a yɛayɛ ɛwɔ mantam biara yɛbobɔ so kyerɛ na nyame ɛnkyɛ adeɛ baabi a yɛbɛkɔ biara ahemfo no ɔmo remfi nti mmerɛ biara ɔmobɔ yɛaba so wokɔ ha yɛse NDC yɛda mo ase ɔmampanyin ma yɛda wo ase ɛfiri sɛ yɛka nea yɛwɔ yi wabrɛ so ɛna nsa kan yɛ police station yi wona wosi maayɛ yɛayaresabea wona wosi maayɛ yɛkwan wona wode koota gu so maayɛ nsuo a yɛnom wona wode nsuo no baayɛ nti ɛyɛ ade a ɛkyɛ sɛ yɛbɔ yɛaba so sɛ yɛayɛ adwuma bebree na ne ɛwɔ mu ne sɛ NDC deɛ yɛwɔ aban mu a yɛnyiyi mu ɛfiri sɛ yɛnyinaa yɛ Ghanafoɔ sika a ɛwɔ Ghana a aban de yɛ adwuma yɛnyinaa yɛtoɔ ɛne yɛde yɛ nti ɛwɔ mu sɛ wobɛkɔ baabi ne aka sɛ saa amanyɔko ne stronghold ni nti ɔna mmerɛ biara yɛto aba ma no ɛnso yɛnyinaa ɛka Ghana no ho sɛ wotwa baabi gya ɛnyɛ yie na wohwɛ asanteman a sɛ woka Ghana asantemantam ɛsombo paa ɛwɔ Ghana ha ɛkyerɛ sɛ ndwuma a ɛwɔ ha koko a yɛte firi ha ɛde kɔ amanɔne sika kɔkɔ a yɛtu firi asase so ɛde kɔ amanɔne na ɛkyerɛ sɛ kɔba se ɛkyɛ adeɛ a ɛwɔ sɛ asante nso nya ne kyɛfa nti nana ɛnɛ deɛ mensɛ wo mmerɛ nso efoto a wo maa me no ɛnsɛnea wokae sɛ asanteman kae sɛ ɛbɛdi adanseɛ pefee na obiara te adwuma abra meyɛ mampanyin meyɛ wɔ asanteman mu ɛnyɛ sɛ mebɛbɔ sɛ mayɛ 1,000 and something projects wei chips compounds nka ho ndwuma a district assemblies ayɛ nka ho sɛbi agyana bia nka ho wei yɛ ndwuma nkasa a abra meyɛ ɔmampanyin yɛyɛ nana bebree nso wadaworoma wotaa yɛkyi nti ne yɛtumi yɛ saa nnwuma yi nyinaa nti mebɔ no baako na ɛdi kan ɛyɛ edwa a ɛyɛ fɛ wɔ West Africa hi nyinaa saa dwa no bi ni hɔ ɛwɔ Kumase ha Kejetia market nana ɛfiri hɔ a yɛsi Tafo market yɛsi Asawase market yɛsi Atonso market edwa nkwa no na ɛba hospital a yɛhyɛ ase esi Sewa hospital Afari military hospital Fomina hospital Bekwai hospital ne nyinaa ɛwɔ asanteman mu ha woba akwan a Asawase town roads Swami town roads Tafo town roads Kenyasi roads High School junction to Janasi roads Bomso to High School road Kote to Aiduasi to campus roads Emena to Bwedi Apromasi to Ejiso Bonre junction to Bonre road Aprede to Parkoso Tikromba road to Antwa roads Bekwai town roads New Edibiasi town roads Bonfa junction to Isiwa road Bekwai to Isiwa road Kumawu to Drombonsu road Tepamanfo to Subriso to Fanti Road. And we are quite a few nine. Yeah, or Asante Maimoha. Nana eba addition. Se Ebekaya. Na you see near friend of community day schools. If you say near say any free senior high school program. And to name him saying Quadano Beba Dosso. And to now see schools ni bika ho. And to your chair schools no Ghana Hagina Yama Asante Mankwa Dumiensa 13 brand new schools. As schools no they shall say Pakosu Community Day School, Agrikanzima Community Day School, Banka Community Day School, Adobera Community Day School, Edujama Community Day School, Drobonso Community Day School, Bosomtre Oyoko Community Day School, Kwabna Krom Obuasi Community Day School, Asoso Offenso Community Day School, Adanse Fomso Community Day School, Adanse Epeja Community Day School, Tepamanfo Community Day School, Ejura Community Day School. Sa emiamia nyina enkrokroe. Yes, Community Day School so ho. Nana nasa eba hospitals ni bi me boy me jai bi kakra. Kumawo Hospital enso ka ho. Tepa Hospital enso eka ho. Neba ensuo asema ye Kumawo Water Supply Project. Konongo Water Supply Project. And a Barikese Water Supply Project, ye be more at the 6 million gallons of water. Eka hon senebeya Kumasi Krono Ebenya Ensiono and Super Anom. Nana Sobe Kanswa Kumasi Airport Abraham Ebeye Omampeni na se free and crying na se free and crying ba. I'll say we drew her before 5 p.m. If you say anajo na plane into me to NC ewo Kumasi na ye Kumasi Airport phase 1 says ada na yekobia no wadaroma obekan ye ho fefefe emie kobie Kumasi Airport no ye san pesika for Kumasi Airport phase 2 ye terminal a ekoso a omusi ye the parliament ye bibia ye ma contractor eco site eco chassis say oye juma me kai say Abra yeto abai new year 5th December yeto nsa efre nana se ombeka ye ho na yemfa asombofom na edwuma no nhyase wentimi amba wankasa nso utu wahemfo kese no baako ebeka ye ho ema ye de asombofom na sa edwuma no so ehyanse nana inti sanyomei na ye asantema mu senebeya asantema so denentuma epa befra na emre bia NDC ewa ban mu yen senior mekan no yen yimu ewo mu se yen dinkuni mewa abato wa santema mu nso wo hwe abato dodo a yenya wa santema mu so eyade a yeni so efisa wo hwe man na wo hwe ne yenya wa santema ebe wo hwe mantem ni na be number 3 HSS.
And that was John Dramani Mahama speaking to Asantehene Otunfo Osetutu II at the Mainshare Palace. We'll come back to Kumasi for updates from my colleague Maxwell Agbagba, who is currently traveling with John Mahama. But let's go quickly to the Upper East region, because earlier you saw us bring you what Vice President Dr. Mahmoud Bawumia had been saying in that part of the country whilst he was on the campaign trail himself. Let's speak to Albert Sori, who has been following the Vice President, Dr. Mahmoud Bawumia. Albert, tell us, where has the Vice President been? What's he been saying?
So the Vice President today is in the Binduri constituency, as well as the Garu and Timpani constituencies. He started the day at Bazwa in the Binduri constituency, where he addressed the chiefs and people there. Basically, it's just the same message which he presented yesterday in the other constituencies at Chanapaga and Navrongo Central. The message is one of asking for a mandate, another 4-year mandate from the people for the MPP government to continue what he says are the massive developments that the Upper East region has seen, which had never been done in the erstwhile NDC government. Now, he's mentioned, for instance, Free Senior High School, which he says that has helped a lot of parents who previously usually had to choose between which one of their wards to pay school fees for, which is no longer happening. He's talked about the Polugo multipurpose dam, which he says is one of the biggest investments ever done by any government in this part of the country, and the MPP government is committed to doing it. He's talked about the Bolgatanga Boko Road, which, he says the NDC government tried to do for several years and never continued. But now a lot of work has been done on the road, and it will soon, be completed. So he's basically been touting the achievements of the MPP government since they came to power the last 4 years, and he's asking that for that development to continue, the people need to renew their mandate.
Right. Albert, thank you very much. I'm sure they have to get back to the rallies that are currently ongoing. Let's move to another part of the country because the campaign trail is spread far and wide in every nook and cranny of Ghana. The Volta region is where we go next. Ivy Setoji is following the MPP campaign in that part of the country. Now, Ivy, tell us first of all, who from the MPP is there and what has the reception been like in the Volta region?
December 7th, 2020.
Papa, who is a spokesman of government affairs, is currently the reception has been great, actually. Of course, you don't expect it to be like that of NDC, but then the reception has been great. And most of the community he's been to in to welcome him. This man has been donating motorbikes to these communities to help them with their campaigns. He's been telling them to do very well, to vote massively for the MP to continue with the development. Especially in Hokwe, he said that without the MPP, Hokwe has seen this kind of development that is currently ongoing. So he has asked the residents of these areas to vote for the MPP so that development in these areas can continue when they return office or they vote back to power. So this is currently he is in Chinderi and they will do the same, helping parliamentary candidates of the NPP to campaign and gather votes for the NPP.
Right. Who are those officials of the party in the region who are with Mr. Kwapa? And is he getting the reception? We missed a bit of what you said earlier, Ivy. I want to know what the kind of reception he's receiving. Yes,
for now, where we have visited, where he has visited, he has received lots of people. A lot of people came. For example, last night when we were in Nkwanta South, in the night around 8 o'clock to 9, we saw a lot of people waiting for Herbert Kwapa. Welcome him, talk to the people together with the parliamentary candidates, the Sherifa. So the places he has been to so far, he has received a lot of people, rousing welcome from these people. He had met some.
Ivy Setoji there in the Volta region reporting on the MPP campaign. They're led by Herbert Kwapa, who is a spokesperson on governance in the Information Ministry. Let's come back to Accra, and Professor Nana Jane Opoku-Agyeman, running mate to John Dramani Mahama, is hard at work at the Ododo constituency. And let's join them currently and find out what exactly has been happening there.
Politics no matter baby bebree ayade abakope eno ne se nipa na wo mo o man no wo mo bra no ebekọ na bi Se nipa no bra ko nanima ena oman no so ekọ nanim. Enti asase wo hu nipa no na hawo. Ohaw ben no wom. Obi ane de ne se mewie school. Anka pesa me ko sua carpentry. Ana pesa me ko sua adepam. Na mom de obetua metinsa no aye asem. Enti aban ohwe na sa abofra no ono na mbasa basa na. Aye san fa so ben na be so ebeba ma no. Fa so ben na beba ma na busu. Na fa so ben so na be fimu aba ama oman no. Enti na ye roje di am hwe ade ni di o se da bi. Sa amofra no esese ye boa om. Say ye twinsa. So be ko be sua be wi no be pon ne ho. Say machine kitu obi obenya no de be kwa koka na danfo ho. Say ye mpam ade mbom. Ano no ansu ko de be kwa kopam na de. O de ni nyina be ma mo. Ese wo mpe we na apere yen. Enti mo ho abaya odwe mofra ho. Abaya odwe mofra ho no aya abaya odwe ndache ho. Ana meboa. Aha. Enti sa de manifesto ye hihye no pepepe.
Let's go back to Kumasi and speak with Maxwell Agbagba, who is attached to the John Mahama campaign there. Maxwell, it's been a very busy day for Mr. Mahama, especially in the Ashanti region. Tell us more about what he's been saying and what the response has been.
Noisy here, but I warn you, can you come again, Daniel?
Right, take us through the activities that we've observed today.
Well, the NDC presidential candidate earlier was at the Mozi Zongo schoolhouse, where he has been interacting with residents and also some Islamic clerics. You know, there was some kind of a mini rally, and he touched on the free senior high school policy. So when the free senior high school education policy, he said, if the NDC is elected into power, they will make sure that they improve it. He says that within 1 year, they will cancel the double track system and make it, a good more schools, so that we wouldn't have anything like a double track system.
And that was the latest from the campaign trail. Remember, this is your election headquarters. It's 26 days to election 2020, and we will be with you every step of the way. We take a few messages here on The Pulse. When we come back, there's a lot more. Don't go anywhere. Welcome back to The Pulse. Thanks for staying with us. Let's focus on our health now, because throughout this week, we have been observing World Diabetes Day, which is themed around the support nurses give. Now, the Nurse and Diabetes campaign aims to raise awareness around the crucial role that nurses in particular play in supporting people living with diabetes. Now, joining me in studio for a conversation on this is Dr. Chris Adai. He is with the Diabetes Endocrine and Metabolic Society of Ghana, DEMSOG, and they have been providing education, patient support, advocacy research, and guidance in clinical care. Dr. Adair himself is a physician specialist and doctor in charge of the diabetes clinic at the Trust Hospitals and Clinics in Accra. Dr. Adair, thank you very much for joining us.
Thank you.
So diabetes, it's become a very worrying condition with over 463 million people affected by it. Tell us about the prevalence in Ghana and the danger that Ghanaians are in from this disease.
Okay. Thank you very much. Diabetes, like you rightly said, is a very common condition affecting all people all over the world. In Ghana, the prevalence hovers around 6.5 to 7%. So given that we are about 30 million in this country, you can do the math. That means about 2 million people are living with diabetes in this country.
Very worrying. How exactly does it affect people? We've heard so much about how it's hereditary, it's about the food that you eat. How do people contract the disease?
Okay, so basically, there are two types of diabetes. There are more, but basically there are two. We have what we call type 1 diabetes and then type 2 diabetes. Type 1 diabetes commonly or usually affects children and adolescents. That is not to say that adults cannot be affected, but it is common in children and adolescents. Type 2 diabetes is the more common of the two, affecting about 9 out of 10 people. Usually affect adults. But with a growing...
So that's 9 out of the 10 diabetes patients?
Patients, okay. Yes, have type 2 diabetes.
Okay.
And the incidence is growing because obesity is the major risk factor for it. And since obesity is increasing globally, diabetes is also on the ascendancy.
Interesting. So would it then be simple to say that if you fight the obesity, you are most likely fighting diabetes itself?
You are right. You are right to say that, because it's a major risk factor. It's a major risk factor.
But then again, like what we hear about the food and the sugar intake related to diabetes. Explain that a bit more for us.
Okay. So here again, I would focus on the type 2 diabetes. That's more common. Now, what happens is that there is a chemical in the body we call insulin. And the insulin is produced by a certain organ in the body we call the pancreas. It's usually at the back. Within your tummy, it's towards the back.
Okay.
Now, the problem in diabetes is that you are either not producing enough or what you are producing is not effective. So we talk about a relative deficiency of insulin or resistance to the action of insulin. So that is usually what underlies diabetes. But then there are several risk factors that will lead to that. I've already mentioned one, which is diabetes. But the others are a sedentary lifestyle, lack of exercise, and then consuming a high carbohydrate diet, especially the simple carbohydrates, sugar, which puts pressure on the organ to produce more insulin to take care of the blood sugar that will be increased after you've taken a meal. And
then there's also rice and yam, which are high in carbs.
Yes, especially what we call the refined carbohydrates. So we have whole grain carbohydrates where you have a lot of fiber.
Okay.
Fiber helps to reduce the rate at which the sugar is absorbed after it's been digested. But when you take foods that are highly refined, such as cakes and white rice,
white bread.
Yes, white bread, then you put a lot of pressure on the system.
Tell me about the age demographic of diabetes, because I understand that 1 in 5 people who are 65 years and above have diabetes. What is special about that group of people?
Okay, so talking about risk factors further, age is one of the risk factors. So as you age, your chance of developing diabetes increases vis-a-vis other risk factors. So you will notice that globally, when you are above 40 years, we advise that you start screening for diabetes because age is one of the major risk factors.
Okay.
Unfortunately, however, because obesity is becoming a problem even in children and adolescents, the age at which we are diagnosing diabetes seems to be dropping. It's unfortunate. I see teenagers, who have diabetes, and it is not of the type 1 that I talked about. It's type 2 because they are obese and overweight. And
are any of them less fatal, the types? Are any of them less fatal?
Well, I wouldn't say any of them is less fatal. We have a lot of complications that can develop from diabetes, whether it is type 1 or type 2. The thing about type 2 diabetes is that there is a period when your sugar is high, but you don't have any symptoms. So it goes undiagnosed for a long time. And by the time we make the diagnosis, some patients have already developed the complication. And in fact, for some people, they actually get a complication, and that is what brings them to the hospital. So somebody gets a stroke or a heart attack, and he comes to the hospital, and it is at that time that we are diagnosing the diabetes. He has never been aware that all along he was diabetic because it didn't cause any symptoms.
So to borrow a COVID expression, you've been asymptomatic. You've had the disease, but we don't know.
Exactly. Before coming upstairs, one of your colleagues down there asked me, and that is exactly what I said, that it is largely asymptomatic, especially the type 2. Most people have been told, oh, when you have diabetes, you'll be passing a lot of urine, you'll be drinking a lot of water, you'll be losing weight. That is true, but that is typical for type 1, which usually affects the children and adolescents.
Okay.
But for the type 2, which usually or commonly affects adults, it is largely asymptomatic. So
it's understandable then that 432 million people have diabetes, but they've not been diagnosed. That's in about 1 out of every 2.
Exactly, you are right. 1 out of every 2 people who have diabetes do not know that they have the diabetes. And
so how then do we make an effort to know?
It's one of the reasons we are having this conversation. We want to create the awareness that people need to screen, at least once a year if you are above 40 years. Or for our part of the world, because being black is also one of the risk factors, we advise that between 30 and 35 years, you should start doing an annual screening, because that is when we will pick it. My dad, for instance, I think he was going to have a hip replacement surgery, and during the workup for the surgery, he was found to be diabetic.
Wow.
He didn't know. Okay,
so he was in the risk population of above 65?
Yes, and he had a strong family history.
Oh, okay.
So like I alluded to earlier on, the risk factors, family history is one of them.
Now that the age you say is dropping, at what age do you suggest that we begin annual checks? For instance, if I have a family history, should I start immediately?
Okay, yes. If you have a family history, and especially if a member of your family has developed a complication of the condition, I will advise that, yes, you start early. As soon as you are aware, you will start. Otherwise, 30 years is a fair time to start. If on the other hand, you have very obvious risk factors, let's say you are obese, for instance. I have a patient I started seeing recently. She's just 25 years, and she weighs about 130 kilos. So straight away, you know that the risk factor, the risk is there for the development of type 2 diabetes. So such a person should start screening way before what I have recommended.
Dr. Adai, we are very grateful for this education, but tell us a bit more about the Diabetes, Endocrine and Metabolism Society of Ghana, DEMSOG.
Okay, so it's a group of medical practitioners. You just need to be a healthcare worker to be a member. You must have the passion for diabetes care. What we do is that we provide leadership in the country in terms of diabetes education, creating the awareness in the public, educating clients or patients who are living with the condition. And in the healthcare system, we have several levels of care. We have primary, we have secondary, we have tertiary level. We aim to train all healthcare professionals. You don't need to be a specialist to be able to manage patients who have diabetes.
Okay.
In fact, the condition is so prevalent that if we were only to ask specialists to see patients with diabetes, you can imagine what would happen.
Yeah.
In any case, as we talk about COVID being a pandemic, you should also be aware that diabetes is a pandemic. The numbers really, you mentioned 463 million as at last year. And as we speak now, I'm sure it's definitely gone beyond
I understand that by 2045, you're expected to have some 700 million cases of diabetes.
And that is even a conservative estimate, because in times past, all the estimates that we made, they were exceeded way before the time. Way before the time. Even this 463 million was projected to happen somewhere after 2030. And we got there in 2019. So these are conservative estimates.
Very, very worrying if you look at the rate of growth there. Dr. Adai, thank you very much for joining us.
You are welcome.
So let's end with some practical information. Maybe I've heard this, I'm convinced. I need to go and screen. What steps do I take immediately?
Okay. So right away, you can go to the nearest healthcare center, ask that you want to screen for diabetes. It's a very simple test. They just prick your finger and then we'll give you the reading. We have what is normal and then what is a cutoff for diabetes. I don't need to give you all the details. It's not necessary. You just need to check yourself in and then you check.
Is it covered by health insurance?
Most of these tests, they are quite basic. So I expect that doing a random blood sugar, even if you walked into a pharmacy shop, I don't think they will take more than 10 or 15 cedis just to check your blood sugar for you.
Okay, that's awesome. That's comforting for persons who may not be in the high economic bracket.
Yes.
So Dr. Chris Adai, thank you very much for joining us.
You're welcome. Thanks for having me.
Right, he's with the Diabetic Endocrine and Metabolic Society of Ghana, DEMSOG, and we were talking about the Diabetes Week. Before we go there, I've just been prompted that let us know what DEMSOG is doing beyond the education, obviously, to mark the special week.
Okay, so like I said, we are mainly interested in creating an awareness because we want to actually prevent the condition. We don't want people coming down with diabetes and then we have to use a lot of healthcare resources to take care of them. Already we are reeling under the effect of COVID. You know the association between COVID and then diabetes.
Yeah.
My patients have been scared. They have always been asking me.
It's an underlying factor that aggravates the condition.
So we are really very much interested in the public awareness. So we have activities lined up to create, and it's one of the reasons why I am here today, to create the public awareness. The other activities also is among the healthcare workers because like I said, the title or the theme for this year is diabetes and the nurse. So we really want to train more nurses, get more nurses interested, and then so that they can empower our patients because we don't want the patients dependent on the doctors. We want them empowered so that they do what we call self-management in the community. You don't always have to rush to the hospital. If you are educated and empowered, you will know what to do.
Okay, maybe if you get a crisis or something.
Exactly, like something we call hypoglycemia, which is low blood sugar. You should be educated to be able to tell the symptoms of low blood sugar. And you should know what to do even before you come to the hospital. Because you can imagine the traffic situation in Accra. You have a low blood sugar, you are in traffic struggling to get to the hospital. If it takes you about 30 minutes to an hour or more to get to the hospital and you don't do anything about the low blood sugar, that could lead to your demise. So we want people to be able to know what to do in such instances before they even get to the hospital.
That's so grateful, Doc, and have a good day. All the best in this week's activities.
Thank you very much.
Now, live on The Pulse with me, Daniel Dazi. Now, authorities at the University of Ghana Medical Center have revealed they are recording increase in critical cases of COVID over the last 2 weeks. There have been growing concerns over the spike in numbers as checks reveal many Ghanaians no longer adhere to the safety protocols. Although the government says the situation is under control and will begin contact tracing and testing again, some health experts are warning that the numbers could balloon by December. Listen to the head of the ICU at UGMC, Dr. Chris O, who says the facility is recording more severe and critical cases. He spoke on News Desk on the JoyNews channel.
As it stands now, with the numbers going up, including severe and critical cases, especially in the last 2 weeks, and we anticipate that is going to continue in that direction. We are in the process. Actually, I'm in a meeting just before you called me, where we are basically reactivating those other centers, and that would include the Greater Accra Regional Hospital, the new infectious disease center in Ga East, and then, if need be, the intensive care units in University of Ghana Medical Center. Yes, so that is a situation at the moment, but as we keep saying, this virus is only defeated by following the prevention protocols that we've reiterated many times. Swearing, physical distancing, and your hand hygiene. And as long as we do not continue to follow this, we're going to have difficulty because our resources are not infinite. We have difficulty in dealing with it.
Doc, is your facility full now?
No. that is exactly what I was explaining, that we had to re-strategize because we do not have, we still have limited human capacity to spread around.
Okay.
So we concentrated in Kolebukchim Hospital. The intensive care unit in Kolebukchim Hospital, as of this morning, we filled the last bed. And that is why I said the strategy is to continue to open up more spaces in those other centers. We are expecting to roll in the new infectious disease center where we have 21 critical care beds within the next 1 week. But again, the problem is not just number of beds, it's human resources. And critical care human resources are limited in our country. It is a resource that we need to be mindful that even if we have 1,000 critical care beds, we're not going to be able to man 1,000 critical care beds. So we do not have enough critical care practitioners, both doctors, nurses, and other cadre of staff. If we have similar to what we had at the end of June and in the middle of July earlier this year. So we, as a country, we actually have to make sure that we do not get back to that situation again.
Doc, are you able to tell us if there are any persons on ventilators?
So currently, there is one person on ventilator, but not intubated. We have different modes of ventilating people. Yes, there is one person on ventilator.
We stay with healthcare delivery because as part of efforts to improve that in the country, the Nurses and Midwifery Council has introduced specialization courses in the nursing and midwifery profession as they celebrate 50 years of existence. The programs are intended to reflect an added value to nurses or midwives seeking to diversify their careers in their chosen specialized fields and also to benefit patients who require their services. Also know more as Gifty Abuajimenta, Public Relations Officer for the Ghana College of Nurses and Midwives, and Barbara Edu, a palliative nurse, join me in studio. Ladies, good afternoon. Great to have you. Tell us a bit more. Let me start with Gifty. Gifty is, Gifty. Yeah. Tell us a bit more about the specialization and the need to specialize in the first place.
Okay, so thank you very much. Ghana College of Nurses and Midwives was established by law, mandated to train specialists in nurses and midwives to augment the need in the healthcare system. This is so because you go there and then most of the nurses and midwives are general nurses. So without the doctors around, you have to wait. So now we need to have specialist nurses. So now Ghana College of Nurses and Midwives was introduced to take care of that. So we train nurses in that field. We have specialists in nephrology, oncology, palliative care, about 13 areas that we train them. Okay. That we train them for that. There's the need, because when you go to the health facility and there's somebody that has to do A, B, or C for you, and there's no doctor around, the next point of call should be the nurse. And we can't afford to have nurses that are just have general knowledge of what they are doing. They have to specialize and understand what the patient is even going through. What you are going through. So that was the need for.
Interesting. So you are a palliative nurse, Barbara.
Yes.
And before this, were there facilities available in Ghana for nurses, public facilities, I mean, for nurses to learn and specialize in any of these fields?
No.
So how did you specialize to become a palliative nurse?
Okay. I had to go to the training at the Ghana College of Nurses and Midwives, as she just said. So you go in with a degree, you know, to start. But this time around, you can have a diploma and then do a 1 year associate member.
Okay.
But if you want to do the 3 year member, you should have a degree to do that.
Okay.
So that's how I entered into.
Okay. So
and to add to that, you have to be a practicing nurse with a valid PIN. before you can do the membership program.
Okay.
If you want to continue to be called a consultant, then you come back and do the fellowship program. But a fresh nurse cannot come. You have to be a practicing nurse. That is one of the qualifications. You have to be a practicing nurse with a valid PIN before you can come to Ghana College of Nurses and Midwives.
So what advice do we have for maybe nurses out there watching us who are asking, why should I upgrade or enhance my credentials?
Okay, let me come in. So specialization is, it's about specifics, isn't it? So we have all these diverse kinds of programs that we have, as she's earlier mentioned. We have the palliative care, the addiction and all of that. So if you come in, you specialize. It's just like division of labor. You have to learn on that job and then do just that. So that makes it easier, right? You have specialized in that area. For example, I have specialized in palliative, so it's easy for me to take care of people who need palliative care than I would have done in the general nursing.
Okay, yeah. Okay. So how does the public benefit from your learning these specializations?
So you meet a nurse on the ward who is a specialist, and it's an emergency. There's something that has to be done for you. You don't wait for the doctor. Now you have somebody, the next point of call, to attend to you, who has knowledge. Because mind you, our mode of training is not the normal general nursing. We do the supportive, clinical teaching and supervision. What I mean by that is, when you are going, we're sending our residents to the clinical sites. We don't just leave them there to be taught by the general nurses on the ward. The person is going with a faculty who is teaching you in the classroom. You go there with a clinical coordinator who has been taught by us to follow the curriculum and how we want you to be taught. You go with a clinical educator who is also to follow a certain trend. Then the preceptor, the person that accepts you on the ward, is also trained by the college. So you don't just go there and they say business as usual. You have to follow it like that. So when you go to the ward or a patient comes to the ward, you are sure that the nurse taking care of you knows what she's about.
Knows what she's about to do. It makes me feel more
You know
confident.
what you're about, yes.
I should say, when I get to the hospital next, I'll ask for a specialist. Finally, tell us about the 50th anniversary celebrations.
So NMC is 50 years, even though we are coming from the college. But NMC as a regulator has been in existence for a very long time and has been helping with streamlining things in nursing and midwifery. Because, of course, we have a lot of challenges and we need somebody to be in charge, to take the bull by the horn and do what is needful. So NMC is there. 50 years we are celebrating, and it is a year-long thing.
Right.
From January to December. So we are really into it and we are having fun.
Nice, nice.
And our theme is projecting nursing and midwifery specialization.
The theme for the celebration is projecting nursing and midwifery specialization, which we are doing now.
Yeah.
So we are celebrating even now.
Yes.
It's amazing. What other activities should we look out for?
So this week we've had a lot of webinars for young nurses and nurse managers. Next week, Ghana College of Nurses and Midwives will be having its AGM, annual general meeting, and we are going to graduate and induct 243 residents that have finished our 13 courses that we do. So the over 100 that we did the pediatrics. That was sponsored by Sick Kids from Canada.
Okay.
We have Johnson & Johnson that are going to do it for mental health. We have Roche that does it for adult oncology. Then now we have World Child Cancer on board now, doing it for pediatric oncology.
Okay.
Because the children who have cancer also need that specialist to help.
Right.
So that is what is coming up this week and next week.
Awesome. We can't wait to take part, to help and support in all of these activities. Thank you very much.
Thank you
for joining us, ladies.
Thank you.
You're still live on The Pulse with me, Daniel Dazel, speaking to Gifty Abuajimenta, Public Relations Officer for the Ghana College of Nurses and Midwives, and Barbara Edu, who is a palliative nurse. We spoke about specialization in the nursing profession. You're still live on The Pulse with me, Daniel Daze. As you may well know, work is being done on a vaccine for COVID-19. There's a German company involved, so we spoke to our colleagues from DW for more on this particular innovation. Stay with us, you'll learn more about this. It's live on The Pulse. Thanks for staying with us. Now, scientists across the globe have welcomed the first evidence that a vaccine can prevent COVID-19. New York City-based drug company Pfizer, together with BioNTech in Mainz, Germany, co-developed the vaccine. The vaccine has been tested on 43,500 people in 6 countries, and no safety concerns have been raised so far. There are, however, questions about how effective the vaccine will be in the real world, how much hope it offers, to whom, and for how long. Let's cross over to Germany and take a look at how Germans and the EU are responding to the new vaccine. Thomas Sparrow is correspondent with our partners, DW. Thomas, exciting news first of all. What's the latest on this vaccine?
So the latest on the vaccine is that the European Commission has been negotiating a contract with Pfizer and BioNTech, the German company, you mentioned that already, to get around 300 million doses of that vaccine. This is important because the European Commission is actually negotiating contracts not only with these 2 drug makers but with other companies as well, to then distribute that accordingly within the European Union, and by the way also when available in other countries. The big question now, the big question that is being debated not only here in Germany but in other countries is first and foremost when that vaccine would be ready, because obviously those tests have been described as encouraging, but that does not mean that the vaccine will be ready anytime soon. And the second question is what will happen once the vaccine is actually ready? How will that be distributed? Who will get access to that first? What will be the priorities? So as you can see, certainly an encouraging decision, an encouraging news story. That was something that was expressed by German officials, but at the same time there are still important issues that have to be discussed and decided on, and that's what is happening exactly now in many European countries.
Now, Thomas, those 2 questions you mentioned are exactly the questions we put down to get answers to. Do we have an indication, for instance, when the vaccine will be available?
When you ask German officials about that, they say that they expect the vaccine to be ready in the first few months of 2021. If you ask, for example, in the United States, there are indications that that could be at the end of the year. It is still a big question when exactly that will happen. It is for now sure that the development is actually underway, and it is a promising development, but it's also relevant to stress that this is not the only vaccine that is being developed. There are many other companies, many other drug makers that are also trying to have their own vaccines, and as such this has been described as a sort of race to see who gets the vaccine out first. Once the vaccine is ready, then the question is how it will be distributed. Here in Germany, there's a commission actually in place to try and discuss precisely these issues, because you can imagine this is not only a practical question, there are also ethical issues related to the distribution of the vaccine. There are legal issues related to the distribution of the vaccine. What has been decided on so far from a theoretical perspective is that priority will be given to those people that are in health risk groups, so for example older people or people with a health precondition. Second in line will be people in the health services, so for example doctors and nurses, so in other words people that have direct contact with COVID-19 patients. And third, people who are described as having relevant professions, so for example teachers or police officers. This is so far what has been discussed here in Germany. The vaccine will be distributed through centralized places, so regional centers, for example, and that has to do with the fact that, one, the vaccine, according to what we know so far, would have to be stored under very specific conditions, for example, cold storage, and second, to avoid that GPs, for example, at a local level would have to decide who gets the vaccine first and who doesn't get the vaccine. So this is why the debate is now focusing specifically on these centers at a national level. This is the debate so far in Europe. Each country obviously can determine what exactly they do with the vaccines that they receive, but here in Germany there is that structure which first and foremost has to do with those who are in risk groups.
Now, Thomas, a recent paper put out by the German Technical Corporation, GTZ, has shown that there is evidence that nearly 40,000 persons of Ghanaian migration live in Germany. How are these people and the rest of the country really responding to the lockdowns that have had to be reinstituted because of the second wave of the disease?
So there was certainly, as you mentioned, a partial lockdown that was reintroduced at the beginning of the month. It will last until the end of the month, although there are negotiations that will be decided on again next week between the German Chancellor and the regional leaders to see, A, how this lockdown is going, whether it is already seeing a specific effect, and B, what has to be done next, depending on that first question. What we're seeing now is that Germany is still recording daily coronavirus cases that are record. So basically various days where you see more and more cases being reported. At the same time, there are also initial indications that a curve may be slowly reducing, that the curve may be showing good signs. This is still, however, very unclear. The lockdown only started a week ago, and as such, German officials are very wary when it comes to deciding what will be the next step. Most Germans do understand the need for these restrictions. They do understand that the only way forward, if you're seeing record numbers, is precisely to stay at home as much as possible, to keep those hygiene and social distancing measures, and so on. But there is also a very evident coronavirus fatigue. That's also certainly the case, something that we clearly see also here in Germany, something that I myself also saw when I was out reporting. The big question for many Germans is what will happen soon. What will happen, for example, in December, when you have Christmas holidays, when you normally go and visit your friends and family, when you normally go out more to do certain things with, again, your relatives. So for now, Germans are obviously, most of them behaving, most of them remaining at home as much as possible, but there are certainly questions, and criticism is also growing as to what the German government is doing and what the German government needs to do to make sure that those numbers go down.
And I must admit, Thomas, that those questions of fatigue when it comes to COVID-19 and uncertainty about how Christmas is going to be celebrated are very, very evident here as well in Ghana. Many thanks for joining us, Thomas Sparrow. It was great talking to you, and stay safe, please. And you're so live on The Pulse with me, Daniel Daze. Let's move to other stories. And seatbelts save lives, but how much do people know about this fact? Well, as you will find out in the following report, some don't even know how to use them. Mamiesi Nyamiche Thompson visited a popular bus station here in Accra and interacted with drivers and passengers.
Rukaya sat at the back of a minibus at the Neoplan station bound for Kumasi. She had no idea what the belt strapped by her seat was. So I offered to teach her how to use it, and she quickly embraced the idea. When you sit in the car, just pull the strap and insert it. It will prevent you from being ejected in case of an accident. Kwabna Mensah, Another passenger did not know how to strap the belt, and although he tried to impress me, it was obvious he did not know what he was doing.
How do I strap myself in? It feels like I'm committing suicide. I know that the seat belt is for safety, case of accident.
Statistics show that 3 out of 4 passengers died during car crashes because they failed to buckle up. I observed that many of the commercial drivers didn't care much for the use of seat belts.
The seat belt makes me very uncomfortable when I'm driving. I prefer to drive without it.
We are flexible to me. I hold this year be all right. Fasten the seat belt. I know we talk about this time, madam. Hey, Ghana car and
but there's a ray of hope. Few drivers buckle up and insist their drivers do same.
It's a rule. It's must. Everybody must wear a seatbelt before the car setup. You a driver yourself and the remaining passenger. It's the first thing you do before the car setup. Because
I always tell them to wear the seatbelt because it protects them.
For JoyNews, Mamisi Nyamche Thompson. And remember to arrive alive.
And remember, please strap up whenever you sit down. Let's all arrive alive. Let's all drive safe so we can see the end of the year together. This is where we draw the curtains on this bulletin of the Pulse. My name is Daniel Dazi. Many thanks for joining us. Keep watching JoyNews. Now to begin